Next speaker is Brandon Erickson again. He's talking about pitch smart. Is it really effective for injury prevention? I think it's working.
Okay. Better? Okay. So we're going to kind of run through some pitch smart. We'll see if we think that pitch counts are effective. What other things come into play for injury prevention? This is a really hot topic, and I think it's something we need to discuss. So what is pitch smart? Well, what it is it's some recommendations from MLB team physicians, some of them in this room, regarding pitch counts and days of rest between outings based on player age. Okay, and the goal of pitch smart and the goal of all of this is to decrease the risk of injury in our adolescent pitchers using these pitch counts and these mandatory days of rest. And what you can see here is this is what the current recommendations are. Now, these will be revamped at some point in the near future, and they'll take other things into account, but this is where we stand right now. So you can see based on age and how many pitches they throw, how many days they need to have before they can go out and pitch again. Okay? So why did this idea of pitch counts start? Where did this even come from? Well, there was a study back in 2002 that wanted to look at the association between pitch counts, pitch types, pitching mechanics, and shoulder and elbow pain in our young pitchers. And what the study basically found was that there was an association between the number of pitches thrown per game, as well as over the course of the season, and the rate of shoulder and elbow pain in these adolescent players. You can see here by the graph there was a significant increase in the shoulder and elbow pain based on the number of pitches thrown. When you look at Dr. Fleisig's study, that was a 10-year prospective study that we quote all the time regarding risk factors for injury. Actually, he didn't look at pitch counts. He looked at overall number of innings pitched in a year, but pitch counts were not a part of this study. Okay, so when we think about pitch counts and fatigue and things, what we're kind of trying to relate is that we know that fatigue increases as kids throw more pitches. And we know that pitching while fatigued is a risk factor. So the thought is that higher pitch counts cause fatigue and therefore increase the risk of injury. Now, we haven't really proven that to be true, but that's kind of the school of thought that goes into this. And we did a study that I've talked about before looking at adolescent pitchers, and we had them throw a simulated game, and we wanted to see what happened during the course of the game, because the thought was if we could find some measurable variable, elbow flexion angle of ball release, max knee flexion height, that started to change as pitchers fatigued, we could then take them out of the game before they got injured. That was the purpose of the study. And so what we had them do is we had them throw a simulated game, and what we found out was that as the game went on, they became fatigued, their pain went up, but really none of the parameters that we thought were going to change actually changed reliably. The only thing that we found was that hip to shoulder separation changed as they started to fatigue, that you can see here. And this obviously was correlated with pitch count. But the question is it correlated with pitch count in every player? Meaning, can some players throw 50, 70, 100 pitches and not get fatigued, whereas other players can only throw 10, 20, 30 pitches and get fatigued, regardless of what their age is? And we don't really know the answer to that. But you can see here that as pitch count goes up, fatigue goes up. So that's what we're kind of worried about. But again, we haven't really correlated that with injury. Now, if you look here at a study by Pete Chalmers and Dr. Romeo, you can see that kids with a history of injury over the course of a season threw about 10 more pitches per game than those with no history of injury. Okay, so that amounts to about 500 pitches a year. And so, again, thinking pitch counts may be something that needs to be looked at further. Now, obviously, there's other factors that come into play here, not just pitch counts, but that's one of the things that we're looking at. So we've instituted this pitch count recommendation, but the question is, how effective are they? Well, there's really not a lot of literature on this. So we did a study because, let me step back. Little League Baseball, prior to 2007, had an inning limit for pitchers. So you were allowed to throw a set number of innings based on your age. Now, however many pitches you threw during those innings didn't matter. You can only go to a certain inning limit, okay? 2008, they switched over to a pitch count limit. So now rather than saying you can throw 5 innings, they said, okay, you can throw 75 pitches, and then you have to come out. So what we did was we looked at all of the youth baseball pitchers between 2001 and 2009 that pitched in the Little League World Series that then went on to play in the majors. And we wanted to see if kids who violated what would have been the pitch count recommendations before they were instituted, meaning pre-2008 or pre-2007, excuse me, if they were more likely to have a Tommy John when they went to play in the majors. And the numbers are pretty small from this, okay? So 62 players who pitched in the Little League World Series went on to pitch in the majors, meaning that was about 10%, okay? Of these, the majority, of course, played in the minors, very few went to the majors. But if you look at what happened, there was a significant increase in the number of players who went on to need a Tommy John surgery if they violated a pitch count when they were younger. This is kind of shown by this chart here. Now, the numbers for this were very small, okay? There were only 6 players that went on to have a Tommy John, so it's really difficult to draw long-term conclusions from this. What we have to do is look at prospective studies where we're talking about having players follow pitch counts and those not following pitch counts to really give you an idea of if this is working or not. This is the best we could do with the data that we have, but I wouldn't hang my hat on this and say, yes, absolutely pitch counts are effective, because I don't think that's true based on this study. The other thing we have to think about when we talk about pitch counts is all the hidden pitches. So in the United States, when kids are throwing, they warm up however they want. Some kids throw 2 or 3 pitches. Some kids will throw 10, 15, 20 pitches before they get warm. Similarly, when you have a reliever that gets up and gets warm and then sits back down, they've thrown somewhere between 10 and 15 pitches to get warm, and then they sit back down again, and then they may have to get warm the next inning and throw another 10 or 15 pitches, and none of that gets added into the pitch counts that we're currently looking at, okay? But I would tell you that while pitch counts are a good place to start, I think there's a lot more that goes into this. We've heard everybody today talk about height and weight as being either protective or being a risk factor for injury. Certainly, as you get bigger, you increase the torque on your elbow just from a physics perspective because your lever arm is getting longer, right? And your weight is getting longer. Velocity, as we know, is the main risk factor for injuries, okay? So the harder you throw, the more likely you are to get injured. It's plain and simple. That's probably the only risk factor that we can all here today definitively agree on that says you throw harder, you throw a fastball over a certain mile an hour, your likelihood of getting injured, specifically to have a Tommy John surgery, is dramatically increased. And it actually increases linearly if you look at some of the studies that we've done. As you start to pitch 1 mile an hour faster, your risk goes up essentially linearly with that. And this is true for mostly college and older players, but we can extrapolate that to the younger players as well. You've heard everybody talk about mechanics today. Mechanics is very important because when mechanics start to dissipate, when they start to get worse as pitchers get fatigued, that really increases the risk of injury. So if you can maintain your mechanics throughout the course of while you're throwing, it probably doesn't matter how many pitches you've thrown because you're still throwing with good mechanics. If your mechanics start to deteriorate, whether that's in the first inning or the 4th inning or the 6th inning, that's really what you have to look at in regards to injury risk in these players. And lastly, I would argue that all pitches are not created equal. Now, forget about the speed of the pitches, but I think there's a certain level of stress that goes on with different pitches. So let's say top of the 1st inning, 0-0 score, 5th pitch of the game. Probably not that stressful of a pitch. Bottom of the 9th, 2 outs, your 75th pitch of the game, 2 men on, 3-2 count, different pitch. Maybe you threw a fastball in both, and maybe it was a 94 mile an hour fastball in the 1st inning and the 9th inning. But I would wager that the amount of stress you put on your shoulder and elbow in the 9th inning was much higher than that pitch in the 1st inning. I can't prove that. That's totally my opinion. But I think that if we can better quantify how stressful the pitches are, this is something we can put into workload. And you heard Stan before mention workload. We're still trying to figure out how to quantify workload. Workload has a lot of different things that goes into it. It's the number of pitches, it's how many days of rest you've had, what types of pitches you're throwing, how stressful the pitches are. So there's a lot that goes into what we consider workload to be. And I think we have to be able to better define what workload is to figure out how these injuries are happening and then how to prevent them. So in conclusion, I don't think we're there yet, okay? I don't think it's as simple as just limiting the number of pitches per game, and this is going to be the holy grail of preventing these injuries, okay? Height, velocity, weight, all risk factors for developing an injury as an adolescent. The current data may suggest that there's a reduction in future injury risk years down the road with pitch counts, but I wouldn't, again, hang my hat on that. So I think it's just one thing that we can use in our toolbox to try to decrease the risk of injury in these players. Thanks.
Thank you.